which is the intensive care unit. The first couple of days, he's not going to look his best. He's going to have tubes. He's going to have a chest tube. He's going to have an incision here. And you'll have some little wires in your belly here, teeny little strings sticking out. That's a pacemaker if they need to pace you, but it's tiny little strings. You'll have a catheter for the urine. And you'll have a breathing tube, but that sometimes comes out very quickly. You won't. Most patients don't ever remember the breathing tube because they sedate you when you have the breathing tube, so you don't remember that, and they remove it and you're awake then. So when you first see him come out of surgery, don't be scared. These are all normal things that every patient having bypass is going to look this way. You're not going to look gorgeous for a couple of days. Then little by little, after about 24 to 48 hours, probably you'll be in the ICU 48 hours. Then you'll just move out to a floor like this. Only it's just down the hall, 4 Central. That's the step down. So you're always going to be on the 4th floor, 4 West to 4 Central. And 4 Central is like a floor like this. They're going to have physical therapy come to see you. But even in 4 West, you're going to be expected the day after surgery. They could usually try to get you up already, because early mobilization is extremely important in preventing a lot of complications that could occur, like pneumonia and things like that. And they'll try to get the catheter out right away for the urine, and you can use the urine bottle again. The chest tube may stay in maybe 2 days, depending, and that'll come right out. And the day that you go home, the little wires will come out in your belly and your IVs will come out. So little by little. But generally for pain management, they give you something called Percocet. And it's amazing to me. My uncle's had bypass twice, and I'm amazed that the second day after surgery, I'm calling him and he's in the bathroom already. Take the pain medicine, because patients who take the pain medicine do better than patients that don't take pain medicine. So if you're sore, you're not going to feel like getting out of bed, and you're not going to feel like doing your deep breathing exercises with that machine, because you're going to have, it's going to be a little sore here, of course, from the surgical site. So by taking the pain medicine, you're actually going to do better, because you're not going to feel as much pain. So you're going to feel like, hey, I feel pretty good. Let me get up and walk. Without the pain medicine, think about it, right? And you're not going to get addicted to pain medicine in a week. So a lot of patients are scared to take a pain medicine thinking they're going to get addicted to it. You don't get addicted to pain medicine. So you need to take the pain medicine, getting up early, and you'll be in the hospital generally 5 to 6 days after surgery. So if you have surgery Tuesday, Wednesday, Thursday, Friday, Saturday, Sunday, maybe the following Monday even. They might keep you, it really depends on how you do. Everybody's different. As far as social work, so on 4 Central, the social worker there will say, hey, you know what, you might benefit for some rehab after your surgery. We may want to send you to an inpatient rehab like Burke or something.
Right. We have one picked out in New Jersey.
Where?
Brighton, it's called, in Edison.
Okay.
My
Great.
sister found it.
And is it a cardiac rehab? You can see if they do cardiac rehab.
I'll find out.
But that's great, because the social worker then can look up that place and arrange it.
Right.
And they'll do transportation generally by ambulance.
Right.
Or if you can if he's well enough to go with you guys, then he can just go home and go right to the rehab place.
Okay.
And we'll see that it's but you can benefit from they call it cardiac rehab, but because that's going to benefit you with getting you back in shape with the heart and the lungs, and getting you up and walking more. And then
so that's about a 4-week period?
Of staying in rehab? No, it depends. Some patients just need about a week in rehab.
Okay.
It really depends on the plan. Take what you can get, though, because it's great. You know, they're going to...
Right.
Yeah, the cardiac rehab sometimes about 2 hours a day of 2 to 3 hours of physical therapy. Yeah.
Okay.
They provide your medicines and everything else.
Yeah, we just want to know what's covered, what isn't, and how much time.
Right, and social worker, and he will be a candidate. He has insurance and Medicare, and that absolutely rehab will be covered.
Okay,
for
good.
Sure, for certain.
Good.
Yeah.
Okay, super.
Yeah, you probably get, and if he has a supplemental, he'll even get more. But generally, a week. 2
Yeah, he's got supplemental too.
Oh yeah, he's going to be fine.
Yeah,
Yeah,
good.
and then the social worker, when you give the list of what you want, she'll just, she'll call and make the arrangements.
Okay.
Make sure there's a bed available, all of that.
All right, but she's not here today.
No, because really it's not a good idea to even talk to the social worker from here, because that's going to change. He's going to be covered by a whole different service after the surgery. So it's those social workers who arrange all the discharge needs.
Okay.
So for here, I wouldn't even think it would be necessary.
Okay,
because
right
there's nothing
now.
she's going to be able to do at this point.
Right, we'll find out after the fact,
Yeah, discharge planning, afterwards.
Okay.
So.
Sounds great. CK.
We're good?
Yep.
Yeah, I wanted to get him the book, but we only have it in Russian. But and 4 Central's a unit down this way. So if you walk around there, you're going to see almost everybody's had heart surgery there.
Okay, good.
Yeah. So the incision takes about a month to heal. I think during that time you have to sit in the back seat of the car away from an airbag.
Yeah,
think I
heard
remember
that.
my
Yeah,
uncle
heard
having
that.
to sit in the back seat because they called her driving Miss Daisy or something because he always had to sit in the back seat.
No airbag. Yeah.
And you might, it's going to be sore, but I'm amazed that patients after bypass don't have more pain. They really don't. It's surprising to me. You would think you would have more. My uncle had that, and he also had lung surgery. He said the lung surgery was 10 times more painful than this. So everybody's different, but pain management isn't a huge thing. It should be good.
Great. Any other questions, Pop?
No, I love listening.
Yeah, we'll go over things as we go through the weekend. I'm here tomorrow. So little by little, that way you're not coming out of surgery and be like, oh my gosh. You might see him and think you might be scared.
Right, yeah.
To see him first.
Yeah.
With the tubes and things. But all of that is controlled and perfectly normal after the surgery. You'll need all of those things in the beginning. And where are they going to take the